Alright, so movement is fundamental to everything that we do with our physical body, from walking to running and to reaching and bending for things. Our joints actually enable us to move in these different directions. So today we'll explore these three essential movements, which are the flexion, extension, and hyperextension of synovial joints. Now, these movements are actually crucial for everyday activities, and understanding them today will help us improve our mobility, prevent any physical injuries, and enhance our physical performance. Now, we'll begin with the flexion. Now, flexion occurs when the angle between two bones at a joint decreases, thus bringing them close together. Now, for example, if we think about bending the arm at the elbow, right here, you're doing a flexion movement. So another example would be pulling your legs at the knee together. Let's say you're sitting in an upright Indian sitting position. You would have to bend your legs in order to sit down. So that's another example of flexion. Now, we use this constantly, especially when we're sitting down, bending over to pick up objects, or simply even nodding our head forward. Now, flexion is possible because it is controlled by muscles that contract in order to pull the bones towards each other. Like again, going back to this example right here, the minute you, even in athletic terms, when you say flex your muscle, you go into this position. So what's actually the muscle that is flexing right here is the biceps brachii. It contracts to pull your forearm upward and bring closer to your upper extremity right here. Alright, same thing happens when you bend your knees together and bring your legs close together in order to sit down. The hamstrings behind your thighs actually contract to pull your lower leg towards your thigh. Okay, so now we'll talk about extension. This movement increases the angle between two bones, returning the synovial joint into a straightened position. For example, going back to that arm movement earlier, this is flex arm, obviously. Now, it's the extension is just the opposite of flexion. So essentially what you'll be doing is extending your arm that way back into its original position. Now, the muscles that work within this movement is actually just opposite to the flexion as well. So when you go into flexion, you're working this muscle, the biceps brachii, and then when you extend it back, you're actually contracting your triceps brachii muscle in order to extend your elbow back out. So the same thing happens once again when you're in a sitting position and you stand up. The quadriceps muscles engage in order to turn your legs into an extended standing position. So we've talked about the muscle induction, extension, but what about the joint that goes beyond the extension range, which is what we call hyperextension. Now, there are some joints in our body where the angle exceeds a typical range of motion. For example, uh, the phalanges right here, your fingers, the extension position is this upright, but you can actually hyperextend this to go backwards. The same goes for the other fingers. Now it might hurt a little, but being able to do that is one example of hyperextension in your body. Right? Another example is when we tilt our head backward. So actually, as earlier mentioned, moving your head forward is actually a flexion movement, and in its upright position is the extended movement. And when you tilt your head back, that is an example of a hyperextension movement. You're going past its upright normal position. So this can also happen in the elbow, knee, and spine, but excessive hyperextension would bring about injuries, physical injuries. So they move back far enough, but not that far as much as these fingers and your head go. Alright? Another effect of excessive hyperextension, it can lead to muscle strain, ligament strain, joint instability, and even long-term physical damage. So that is why it's important to maintain proper posture and use controlled movements when we're exercising or lifting any heavy objects. Flexion decreases the angles between bones, thus bringing them closer together. Extension does the opposite of that, increasing the angle and returning the joint to its neutral position, and hyperextension moves the joint beyond its typical range. Now, understanding these fundamental movements can improve mobility, prevent injuries, and enhance physical performance in our everyday life.
Opposition, reposition. The tongue forms a joint with the trapezium bone of the wrist via saddle joint, a type of synovial joint featuring interlocking convex and concave surfaces. It's called a saddle joint because it resembles a saddle. Thanks to this joint, the thumb can perform various movements such as circumduction, flexion and extension, abduction and adduction, as well as special movements called opposition and reposition. Opposition happens when the thumb touches the tip of another finger on the same hand. An easy way to remember this is that humans have opposable thumbs, meaning they can move their thumbs to touch their fingers. When you do this, your fingers and thumbs make an O shape. While reposition is the opposite of opposition, during reposition, the thumb and finger return to the original positions. And now, I'm going to demonstrate the protraction and retraction of the body. Protraction and retraction. So, protraction and retraction, which are special body movements that involve the scapulae, or better known as your shoulder blades. Protraction moves the scapula forward or anteriorly in towards the side of the body or laterally in an anterolateral direction. While retraction is the opposite movement, it's going to cause the shoulder blades to move back or posteriorly and more toward the body's midline, or a movement known as posteromedial movement.
Ikaw lang, basta ano ako pa.